Hi, my name is Courtney Holtzclaw, and I chose to look over the Affordable Care Act. So here's kind of just a little rundown on what the Affordable Care Act is. It is a federal healthcare reform law created in 2010 aimed to expand health insurance coverage, improve healthcare quality, and reduce costs. It aligns with social policy themes such as access to healthcare, equity, and government interventions in social welfare. So for this policy, here's my research and plan. So here's the policy overview. Signed into law by President Obama in 2010, the ACA was designed to reduce the number of uninsured Americans and reform the healthcare system by expanding Medicaid, creating insurance marketplaces, and mandating coverage of preventative services. The main goals of the Affordable Care Act are to achieve near universal health insurance coverage, improve affordability and fairness in health insurance, enhance healthcare quality and efficiency, expand access to primary and preventative care, and invest in public health initiatives. So here is the impact analysis. The intended outcomes of this policy is to reduce the uninsured rate by over 30 million people, expand Medicaid and cover low-income adults in many states, require coverage of preventative services without cost sharing, improving access to screenings and vaccinations. So with those outcomes, there are consequences, and those consequences are increased hospital mergers lead to regional monopolies, which can raise healthcare costs by up to 20% in some areas. Narrow networks in insurance plans exclude some providers, which just means that not all providers are going to be covered by the insurance. And then potential for increased healthcare expenditure despite cost-saving intentions due to healthcare consolidation and billing practices. If I were to have recommendations for this policy, here's what they would be. So my first recommendation would be to address hospital monopolies, which this would implement stricter antitrust enforcement and policies to prevent excessive hospital consolidation. My second recommendation would be to expand network flexibility. This would encourage broader provider services to increase patient choice and competition. My third recommendation would be to enhance cost transparency. By doing so, this would require clearer billing practices to reduce unexpected patient costs. My fourth recommendation would be strengthen preventative care funding. By doing this, it would increase investment in community-based prevention programs to reduce long-term healthcare costs. And my fifth and final recommendation would be to monitor and adjust ACO incentives. This would refine accountable care organization frameworks to balance cost savings with quality and access.